Welcome to Female Reproductive Disorders. First thing we're going to be talking about is uterine bleeding disorders. So the pathophysiology is metrorrhagia or menorrhagia. So metrorrhagia is bleeding or spotting between menstrual periods, and menorrhagia is menstrual periods with profuse or prolonged bleeding. So the first one is between, and the second one is prolonged periods, profuse bleeding. And then amenorrhea, I'll add that to the list of words, and that means with no period, right? A always means without, so just before a word, let's learn our lingo, nursing lingo. Cause and risk factors could be hormonal or secondary to tumors. Medical diagnosis and treatment, they'll base that on a test or any procedures that are done, maybe some lab tests. Nursing care, you want to get the patient's menstrual history, teach the patient about what is normal, what to expect from what the doctor's going to be doing, why they're feeling the way they're feeling anemic because they've been bleeding, they've been feeling really tired. You want to explain that, why that is, and what their lab test maybe is. And then the amenorrhea, why they're not having a period, maybe they're pregnant. And then you might want to be able to talk about the surgeries. But normally, nursing care, you just want to really be a good teacher and a source of emotional support. So the first thing I'm going to talk about is vulvitis and vaginitis. So the pathophysiology is it's an inflammation of the vulva. The cause risk factors, now there's two, and you do need to know them. They're in red, so I want you to put these in your mind. So the first one is Candida albicans, and you know that can also be abbreviated C. albicans. It has a distinctive odor and cottage cheese-like appearance. The second one that you need to know is Trichomonas vaginalis, also could be abbreviated T. vaginalis, and that has profuse, frothy, and yellow-gray in color with a fishy odor. Now, one of my very first nursing jobs was in an OBGYN's office, and on the phone, I would have to say, so, tell me about, they'll say, I have a discharge. Well, what color is your discharge? Well, what does it look like? Well, what does it smell like? And I had to get all of these distinctive characteristics of each infection. Yeah, they'd still have to come in so the doctor could take a peek. But Candida, distinctive odor, cottage cheese-like appearance. And I would have to say, so is it cottage cheesy? Gross. Trichomonas vaginalis, profuse, frothy, yellow-gray in color with a fishy odor. All right, signs and symptoms, they can have itching, swelling, redness. Complications, you want to avoid these infections. You want to avoid having them go further than just the vagina as well, because they're going to develop into another illness we'll talk about later. Complications, again, avoid the infections. Medical diagnosis, you want to go by the symptoms and the discharge, and you would document that for the physician, or the physician will document that. Medical treatment, during the course of treatment, if the patient has been found to have one of these infections, they need to tell their sexual partner so that that partner can be treated also. Otherwise, they're going to be reinfected with that same infection. I know that's kind of hard. If there's multiple sex partners, they need to be told. Nursing care for that is just be supportive. Barthel gland abscess, very painful. Pathophysiology, they're vulnerable to numerous infections because these glands, if you look in your book back in the introduction, the glands are right at the opening of the vagina. So they're very vulnerable to infections. The cause and risk factors that can be transmitted from the anus, which is not too far from the vagina in the female, the vulva or vagina. It can also be related to improper perineal care. You'll see this coming up multiple times. Signs and symptoms is perineal pain, so pain in the area of the vulva and the glands, the Barthel glands. Complications, it can progress to systemic infections. Remember, vagina is an opening to the inside of the body. So systemic, it can go systemic. And I've seen these Barthel glands have to be, because when they get abscessed, they're filled with fluid. And it can be gross fluid. So they need to be drained. And that's painful in itself. They could take sitz baths for the discomfort. They can take pain medications. All right. Nursing care, basic hygiene practices. All right, cervicitis. So cervicitis is inflammation of the cervix. Cause and risk factors for that. I'm sorry, I'm looking in the book. So I'm looking with you. So cervicitis is diagnosed and treated in outpatient settings. In most cases, the physician, the nurse practitioner, or the patient administers treatment. Nursing care is limited to assisting with assessment procedures, patient support, and teaching the patient to carry out the prescribed treatments. Mastitis. So the pathophysiology on this one is inflammation of breast tissue in the lactating woman. Any of you who've had inflammation of the breast tissue or the mammary glands, it's very painful. They can get clogged. It's almost like a pimple at the clogging of the milk at where it's supposed to come out at the nipple. And then that causes a backup of the milk, and it can cause a massive mastitis or inflammation of all of the breast tissue. I've seen it so bad that patients have to be on IV antibiotics after delivering a baby. They're breastfeeding, and then they get this major mastitis, and they need IV antibiotics. So cause and risk factors, usually just a Staphylococcus aureus, which we have on our skin anyway. It by no means means anything bad or that you've done anything wrong. It happens. Signs and symptoms, pain, redness. Complications, you can develop an abscess, might need to be drained, warm compresses, a warm shower. I won't go into my experiences with this, but warm showers are very helpful. Long warm showers until it's relieved, and the warm compresses very helpful. Fibrocystic changes. The pathophysiology is an exaggerated response to hormonal influences. Causes and risk factors. Fibrocystic changes are more common among women who have never given birth, have had a spontaneous abortion, and had an early menarche, which is your period, and late menopause. The risk is also greater for women who've had premenstrual abnormalities and do not use oral contraceptives. Signs and symptoms would be smooth, round bumps that move freely. Medical diagnosis and treatment, there's really no cure for that. They might change hormones to adjust how much hormone you're getting. Medical diagnosis and treatment, no, as I said, no cure. But you can be given a medication called Danacrine or Danazol, and that reduces the side effects of this exaggerated hormone because it cuts down on the hormones. And if you remember in the last chapter, we talked a little bit about this, and we talked about the side effects. Excessive hair growth, deep voice. Important information. I mentioned it twice. So let's talk about PID. So this is, the pathophysiology is infection that may affect structures in the pelvic portion of the reproductive tract and peritoneal cavity. Because remember before I mentioned the vagina is an opening to the inside of the body. So an infection can travel the vagina, the uterus, fallopian tubes, out that fallopian tube into the abdomen or peritoneum. And then that's a major infection, inflammation. Cause and risk factors, majority of the cases are caused by sexually transmitted organisms. Signs and symptoms, dyspareunia. Now, that word, good word, well, it's not good, but it's good to know. Dys means painful. Periunia is intercourse. So it's painful intercourse, dull abdominal pain. Complications can be infertility because of that constant inflammation of the reproductive tract. And then an ovum may not be able to fertilize. So medical diagnosis would be do a culture, find out what is the bacteria that's causing this problem, and then they can get oral or parenteral IV antibiotics. And follow-up is always recommended to be sure that your symptoms and discomfort and infection is going away. So follow up with your doctor to ensure the treatment is successful. Because unless they've done a culture and know exactly what they're dealing with, they really might be shooting in the dark there. All right, let's move on to, now this comes from your book, Precautions to Avoid Reproductive Tract Infections. This is patient teaching. So where this is important, and it's also on page 1021 in your book, I know it's better, well, this is right from your book, but if you've got the book, it's on page 1021. Otherwise, it's under patient teaching, precautions to avoid reproductive tract infections. And what's important to remember here is that wipe the perineal area front to back. Now, I know we've talked about that before. You know it to be true, but it may be a teaching site because if your patient keeps getting infections or it ends up with a PID, major infection, they're doing something wrong maybe. So, teaching, wipe front to back. Now let's talk about common sites of endometriosis. So I just want you to put this picture here so that you can see, remember that endometriosis is retrograde menstruation. So the altered function of immune-related cells, the most popular theory is the Sampson theory, suggests that retrograde menstruation seeds the peritoneal cavity with endometrial cells. Now these cells can be found in all parts of the body because the peritoneum opens up inside. So if you have any rebound or reflect of the uterine lining, it can go anywhere in the abdomen. So endometrial cells are deposited in the pelvic cavity and they respond to hormonal stimulation and form cell clusters inside the peritoneum. And these cell clusters can be chocolate cysts, they're called, because of their color. Cause and risk factors may be linked to immune system defect, or not quite sure. Signs and symptoms: dysmenorrhea, or painful menstruation, because that's when your hormones are activated. And this activation of hormones is what charges up these endometrial cells to inflame because of the hormone release while you're building up the lining of the uterus. Complications can be constriction of bowel or ureters. That's important to know, because when you think about this rebound or this reflux of endometrial cells, or the lining of the uterus that's in the pelvic cavity, can go to the ureters or can wrap around the bowel. And we saw in that picture of the pelvic cutout that it can go anywhere in that area. So beware of the constriction of bowel or ureters, because it can cause an obstruction, because it gets so tight, and ureters aren't that big anyway. And that can create an emergency situation, because you can see if the ureter's clogged up or blocked up or constricted, the urine's going to rebound up into the kidney. Medical treatment might be a hysterectomy. Now, I love this next one, salpingo-oophorectomy. What that means is, salpingo is your fallopian tubes. Oophorectomy is, I think I left out an H there, is your ovaries. So that's, and you may see it as TA, total abdominal salpingo hysterectomy, TAHBSO, bilateral salpingo oophorectomy. Maybe you've seen that on charts. So that's what that means. And for nursing care, pain relief, you've got to understand that they are going to have pain, and be understanding and give them some pain relief, some pain medication. So just remember that the complication of endometriosis is constriction of the bowel, ureters, or both. And it can lead to a medical emergency. Now, cysts, a closed sac-like structure that is lined with epithelium and contains fluid. It could be some of that fluid that was released when your ovum was released. Classified as neoplasms and may be benign or malignant, but the majority are benign. And you probably heard the word polycystic ovary disease. Well, that's what this is. So fibroid tumors, pathophysiology, they're usually benign and common. It's predicted that at least 20 to 30% of all women will develop fibroid tumors during their reproductive time. It grows slowly during the reproductive years, but tend to atrophy after the onset of menopause. So they think the cause of all this is estrogen. That's why it's usually during the younger years or the reproductive years. Signs and symptoms of a tumor, fibroid, is menstrual irregularities. Complication can be infertility. Medical diagnosis is made by a pelvic exam. Sometimes that enlarged uterus, you may think you're pregnant because that tumor has gotten so big. So they might do a pregnancy test, Pap stain, CBC, and some other blood tests to rule out other problems. So nursing care of the patient with a fibroid tumor. Now that leads us to actually the nursing care plan on page 1026, which is a patient with a hysterectomy and all the things that occurs, the potential for low self-esteem related to potential changes in their femininity. So because if the uterus is removed, that is a reproductive organ, that can lead to feeling of loss. There's a lack of knowledge related to information or misinformation of effects of hormone replacement. A lot of people don't want to take hormone replacements, but sometimes it's necessary. Inadequate peripheral circulation related to anemia. So always want to watch out for bleeding. And there would usually be bleeding after hysterectomy. Now, hysterectomies can be done through the abdomen or the vagina or endoscopically. Also, potential for fluid volume deficit related to post-op bleeding. Now, this is really important if you're looking at the nursing care plan here for a patient with a hysterectomy. Oh boy, let's go on. Okay, this one right here. I made a whole slide just for you. Potential for fluid volume deficit related to post-op bleeding. So the patient will maintain adequate fluid volume, fluid intake and output. Hopefully, when their bowels start working in, they can take fluids. Otherwise, it's just IV fluids. A stable pulse and blood pressure, so their vital signs are stable. Now, what you have to be sure to report any drainage observed on the dressing. Check abdominal dressings and perineal, which is like a pad, at least every hour for the first 12 hours, and watch for excessive vaginal bleeding. And the way that you tell that is it should saturate less than 1 perineal pad per hour. So that's what you want, but what if you have more? You're going to count them. Count the pads that you've had to use. So keep track how many pads you're using, and that will be indicative of how much bleeding they're having. But it should saturate less than 1 perineal pad per hour. Okay, so Sista Seal and Rectus Seal. So these are vaginal disorders caused by weakness of supportive structures between the vagina and the bladder. So the Sista Seal is the opening between the vagina and bladder, or the vagina rectus seal is vagina and rectum. So these are weaknesses. Cause and risk factors: pregnancy and childbirth. Muscles get weak. Muscle floor is weak. Symptoms: bowel and bladder problems. Dyspareunia, lower back and pelvic discomfort. The treatment: to make those supportive structures stronger, the patient should do Kegel exercises. If you remember about those, that is tighten the buttocks and the abdomen in, tighten up for the count of 10, and then release for 10, and then tighten up for 10 more. And that will strengthen those supportive structures. All right. They are at risk for incontinence, constipation, altered sexual function, potential for infection, pain, potential for injury. A low residue diet reduces fecal bulk, and stool softeners are recommended to prevent straining during defecation after surgery. You want to be a good teacher and teach about what they had, why they had it. Uterine prolapse. Now that's weak ligaments, also due to pregnancy or childbirth. Signs and symptoms: dyspareunia, backache, abdominal pressure. Complications would be second and third degree prolapse, where the actual uterus prolapses out of the vagina. I've seen that before. I'll never forget the first time I saw that. But if that happens, because the uterus is not supposed to be outside, right? So it can get necrotic and erode. Also, it can rub against the sheets and get irritated. It's bad. Medical treatment could be colporography, sorry. Most common surgical treatment for uterine prolapse. They might also just get a pessary. They don't use those too much anymore. They use slings more now, but you might still see a pessary from some of your older patients. Those need to be removed and washed and cleaned and can be put back in. Okay. Nursing care, you just want to observe the patient for discomfort. Retroversion, retroflexion, anteversion, anteflexion. So retroversion is the backward tilt of the uterus. Retroflexion is the body of the uterus bends back on itself. And there's some really good pictures if this isn't descriptive enough. It's on page 1030 under patient with a uterine prolapse. The anteversion, uterus tilts forward. Anti usually means forward. Retro means back. So anteflexion, uterus bends forward on itself. Cause and risk factors, again, those weak ligaments, the pelvic floor, musculature related to childbirth. Signs and symptoms would be dyspareunia, low back pain. Complications, uterine displacement. Complications aren't really that bad. So let's turn our page here. And there's your good pictures there, types of uterine displacements. So you can visualize that. Okay, vaginal fistulas. So these are abnormal passageways between the vagina and other pelvic organs. So there is a vesico-vaginal fistula. Now remember, fistula in general, that word is a false opening, an abnormal opening. You can have AV fistulas, right, where they get dialyzed. You can have fistulas between organs. The colon and the bladder can have a fistula from diverticuli. So just remember, a fistula is an artificial opening or passageway. There's a vesico-vaginal fistula, which is a fistula between the vaginal and urinary bladder. I have a good story for this one. So, prison, female patient, comes in, she's drunk. Well, how can she get drunk being in prison? There's no alcohol. I know they do make some there, but she swears she had not been drinking anything. Well, what had happened is she had a fistula between her vagina and the urinary bladder, and she was actually, yeast was growing there. So she was actually making her own alcohol in her body. Is that a good story? Then there's a urethrovaginal fistula located between the urethra and the vagina. A rectovaginal fistula located between the vagina and rectum. Now that could be pretty dirty, huh? Surgical correction is often needed. Some fistulas close spontaneously. All right, we're getting into breast cancer. So this is just a picture. It's in your book on page 1036. So while we're looking, well, actually that picture, I'm sorry, is on page 1035, and it looks awful. But I want to call your attention to, this is how surgery is done. The normal anatomy, how that looks, is their first box. Second box is a modified radical mastectomy. and there's usually drains in there. I had a friend that had a mastectomy. She had one of those bulb drains. In a simple mastectomy, the breast tissue and usually nipple are removed. Now they actually lift up the whole breast and then put it back down so you still can keep your nipple. Of course, it depends on where your node is. But there's been, because it's such a common surgery now, there's been a lot of improvements in the surgery itself. So then a lumpectomy, you can see on the fourth picture there, and you can see the lymph nodes that they take out. In the third picture too, you can see the lymph nodes really well where they're distributed in the arm. And they have to remove each, or check each one of those to see if the cancer has spread or metastasized. On your next page, I don't think I did the picture. Oh, I did. Good. Okay, so stage 2 is what I really need you to pay attention to here. So stage 2 cancer, notice it's a tumor 2 to 5 centimeters big with 0 to 1 lymph nodes positive for cancer, but no metastasis. So that's would be like a T2, N1 nodes. Remember our TNM? M is metastasis. There would be a 0 because there's none in stage 2. But notice how they're staged. Stage 3, tumor larger than 5. Lymph nodes positive, no metastasis. And then stage 4, tumor of any size with or without lymph nodes positive for cancer cells and distant metastasis. So it has already spread. Normally it spreads to the brain and the liver, the most common places it goes to. But stage 2 is important to remember. Okay. So let's talk about breast cancer. It's the most prevalent form of cancer in women. The cause and risk factors could be the BRCA gene or the BRCA mutation gene. You can get that. You can get tested for that. It's a lab test. Family history. If it runs in the family, maybe you want to go ahead. Some people go ahead and just have their breast removed so they don't have a risk of getting cancer. Late menopause is a risk factor. Obesity, excess alcohol, sedentary lifestyle, oral contraceptives, the hormone, and that BRCA gene, it is sensitive to hormones, so that's why it's so it's sensitive to you. And we have hormones naturally, and we have oral contraceptives too. Those are fake hormones given to us to suppress hormones, but those can lead to cancer as well. Now, the prognosis depends on when it's caught, right? The survival rates are determined by comparing survival rates among cancer patients with overall survival rates in similar groups of people. So it's usually confined to the breast. The 5-year relative survival rate is 96%. When the cancer is spread to surrounding tissue, 5-year survival rate is 75%. If the disease has metastasized, the 5-year survival rate is reduced to 20%. So it says, see cultural considerations. So low-income African-American women more often have advanced diseases when diagnosed. And maybe that's because they didn't have the knowledge. Maybe they didn't have the resources. Caucasian women are more likely to die from breast cancer. There's a bit of denial that goes along with breast cancer too. Like you really don't even want to do the exam. It's fear, right? Every month you have that. Am I going to feel anything? I know it runs in the back of everyone's mind, every woman, especially if it runs in the family, but not always. So prognosis depends on when it's caught. And then signs and symptoms could be a painless thickening or lump. That's why it's so, so, so important to do your breast exam. A medical diagnosis is made by mammogram or MRI. A medical treatment is the critical factor to determine cancer cells or estrogen receptors. So they need to determine, are these cancer cells estrogen receptive? That will determine the medication. And look at tamoxifen, which is a SERM. That's estrogen receptive modulator. So tamoxifen, you've probably heard of that. It's a SERM. That's the type of medication it is. It blocks estrogen from reaching the receptor cells. So that's important to know, tamoxifen. Then the nursing care plan that's important for you to know here is the body image change that these patients go through. A breast removal, it's a big deal. That's part of the female anatomy. It's a reproductive, it's a visual also. So if that is disturbed, they might feel like they've lost something. They're changing body image. They get low self-esteem. So you need to be accepting and help the patient express their feelings. Really important to remember about that. Also, potential for injury. So after surgery, the potential for injury is that swelling. And remember, swelling is going to block blood flow. So they are at a potential for injury. So their arm needs to be elevated to the height above the heart. And that helps to drain the fluid. And if they've had to take out nodes, those nodes help us, our lymph node system, remember, helps get rid of our fluid. So if you lift the arm above the heart, that gravity helps decrease the amount of fluid that's accumulating and allows for the lymph system to take it to the heart and then diffuse that so that we can urinate that extra fluid out. All right, so just remember to be accepting of their feelings and help them express themselves. So cervical cancer is another thing, female related. So be sure to have regular pelvic exams and pap smears. That is the best way to have cervical cancer just deleted. So cancer will be diagnosed early if you have a yearly pap smear. If you get us to be a certain age and you haven't had any problems, they will decrease the pap smear. It doesn't have to be yearly. But in the younger years, you do need to have a yearly pelvic exam and pap smear so that the cancer can be diagnosed and treated early. It's very slow growing, so if it's caught early, you can be healed. Cause and risk factors can be HIV, the human papillovirus. That is a big thing right now. Getting the injection to decrease the risk of cervical cancer by getting a vaccination against the human papillovirus. Signs and symptoms, early signs asymptomatic. Advanced signs, it might be menstrual irregularities. Complications could be the invasion to adjacent structures. You might even not know this is happening because it's so not symptomatic. But you might not find it until you have a problem somewhere else. It is diagnosed by biopsy, so when they do the pap smear, they take a scraping of the cells and look at those under a microscope. If there's any irregularity, they might order a biopsy, and that's a cervical biopsy. They do a punch biopsy of the cervix. If there's mild dysplasia, electrosurgical excision, they might burn that. Localized, if it's localized, so let's say this again. Medical treatment, if there's mild dysplasia on the cells, there's electrosurgical excision, so they cut it out. If it's localized or in situ, they can have cryosurgery, the freezing. Invasive cancer, they might need radiation, surgery, or both. Nursing care, just support, be sensitive to the patient's feelings. Ovarian cancer, sneaky, sneaky ovarian cancer. Although the incidence is low, the mortality is high, basically because it's asymptomatic until it's advanced. Cause and risk factors, there could be a family history, endometriosis or colorectal cancer, so it could be a metastasis type of a cancer. Signs and symptoms, again, asymptomatic in the early stages. Now, I have a story for this one. I think I've told you this story before, but I might as well tell you again because it's apropos right now. I had a friend, and she wanted to go buy some new clothes. She was feeling fine. We went shopping, had a great time, lots of giggles, and you know, it's fun to go shopping, right? Try on new clothes. And she needed some new clothes. And she said, Debbie, I don't know. I've gone up a size. My stomach's getting swollen. I don't understand it. It'd just be my age. And we'd kind of laugh, you know. She had no pain or anything. And then one day, she ended up with a bowel obstruction. Severe abdominal pain. The cancer had wrapped around her colon. And that's how they found her ovarian cancer, was she had symptoms from something else. And that's what happens because it spreads. Now, who thinks bloating is ovarian cancer? You don't want to be so, you know, afraid every time you get bloated. But that is one of the major symptoms. So complications spreading to the peritoneum. Now, a person that had this, you may know or not know, Gilda Radner. She was on Saturday Night Live. I took care of her at Cedars-Sinai down in Los Angeles. And she wrote a book, actually, about her experience with ovarian cancer. You know, but it's a humorous look because she was a humorous lady. It's not funny, though, unfortunately. Okay. Medical treatment, surgery, if they can do that, but by the time it's found out, it's usually too late. Now, there is a tumor marker for ovarian cancer. It's CA125, and that could be a lab test that is done, or you can have checked. Okay. We'll talk about vulvar cancer. I've only seen this once in my career. It's relatively rare, but it's one of the most visible of the cancers of the female reproductive system. It may appear as a visible and palpable lump of the vulva or a deviation from the normally pink, moist mucosa. Although it's rare, malignant melanoma may occur in the vulva. Its incidence is highest in postmenopausal women. Cause and risk factors. More than half of these cancers are linked to having had an infection with a high-risk type of HPV. Other risk factors are smoking. Signs and symptoms. Most common reported symptom is pruritus or itching. Pain and bleeding are additional. Complications, it usually remains localized, but it can become invasive if not discovered and treated. Diagnosis is made through palpation and visualization. Medical treatment depends on the extent of the cancer, if it's malignant or if it's spread or not. Can have laser surgery, chemotherapy, radical hemivulvectomy can be done. Again, nursing care would be just focused at caring for the patient, the same as caring for the patient with cancer of the cervix, ovaries, vulva, and vagina, checking for blood drainage, and be a source of support. Infertility. There's a lot on infertility, I'll tell you now. So, primary infertility, the woman has never conceived and the male has never impregnated. Secondary infertility is where the woman has conceived at least once, but then is unable to conceive again. So the definition of infertility is they're unable to conceive, and this is important to remember because it's a definition. Definition of infertility, they're unable to conceive within 1 year of regular unprotected sex. So the cause and risk factors are listed on your box 52.2. I'll point you to that right now. Female gender, developmental uterine abnormalities, endocrine can be dysfunction, diseases could be PID or other infections. The male can have undescended testicles, endocrine hormones, diseases, and then both male and female, STIs, cancer, immunological incompatibility. Medical diagnosis for the male is made through semen analysis, and I will talk about that again in the male anatomy and physiology. So after sexual abstinence, assess for volume and sperm count. So that's what the semen analysis is. So they must abstain from sex, and then their semen is analyzed for volume and sperm count. The woman is to take a basal temperature. That's just really taking your temperature each morning upon awakening before you get out of bed. So that used to be the old way of finding when you would be the best time to get pregnant, taking your basal temperature. So that is a way to check infertility as well, to see if you're ovulating. Taking the temperature each morning upon awakening, or endometrial biopsy, and also measurement of progesterone. So that's important because, again, it tells the doctor, it's a blood test that can tell the doctor, is your body capable of getting ready for a viable sperm and ovum? So that's one thing they'll check for. The doctor will check for your progesterone level. Also, medical treatment can be in vitro fertilization, but unfortunately that's very expensive. A lot of people can't afford it. It's very timely. You have to be committed to injections, and it's very expensive. Nursing care, it may lead to difficulty coping. An infertile couple may feel really terrible about the whole thing and feel insecure about it and have really bad feelings about not being able to have a child. So we need to encourage their patients to express themselves. I'd like to just for a second just go back to our medical diagnosis here. When I talked about the woman taking her basal temperature each morning, endometrial biopsy, and the progesterone. So there's actually 3 things involved with the woman. Also, the doctor may determine if they have a fallopian tube, if they're open, fallopian tubes are open. So they might have a hysterosalpingogram or salpingography. So they'll check, they'll put dye there to check and be sure the uterus and fallopian tubes are open. So now let's move on to menopause. You can read through some of this about infertility, your nursing care, your focused assessment, your interventions, their low self-esteem, their altered sexual function, inadequate coping, lack of knowledge. I tried to point out the important points that you need to really focus on. Menopause is a cessation of menstruation, which means the end of reproductive capacity. Different ages for different people. It comes upon them, can be slow onset, can last for a long time, or then it can just be over. Everybody has a different kind of experience and a different story to tell. Signs and symptoms can be hot flashes. That's probably what you hear of a lot. Feeling hot and then cold. Vaginal dryness. All the skin gets dry. It goes with aging, which is part of the menopause also. Insomnia. And that's a very common one too. They have trouble sleeping. Joint pain, headache. And this is all, from their hormones changing and going up and down. And that's why they'll have hot flashes and then they'll be cold, and it's up and down for quite a while. Sometimes it's a year, sometimes it's less than that. It's just different for everyone. Medical treatment can be estrogen therapy, and estrogen can be taken orally, it can be given vaginally. Vitamin D, calcium, we know is important for our bones, and with menopause we can get osteoporosis, so vitamin D and calcium are really important. Vitamin B complex is good as well. Nursing care, we want the outcome for the patient to have reduced symptoms. It's not going to happen overnight though. They're going to have to work at that, and it might be a little while. Okay, I think I have one more thing. A question. So infection with which organism is thought to be the most commonly occurring sexually transmitted disease and the one most responsible for PID? Give you a second. Remember me mentioning to you the first initial is a word that you probably heard. So the answer here is A. So Candida. Is C Candida? Trichomonas? Trichomonas? That's how you probably know it, Trichomonas. All right, so the answer here is A. Thank you.